Hello ladies and gentlemen, Ollie here and welcome back to my channel. Today we are going to be tackling another practice question to help you ace your med school interview. So imagine for me that you are a junior doctor or a medical student working on a hospital ward, and in this instance a patient's blood sample has gone missing. You don't know where it is, but what you do know is that another blood sample needs to be taken quite urgently. How do you communicate this to them? Now, it doesn't have to be blood, it could be urine, stool, or any other bodily substance of your choice, but fundamentally this is a very common type of question because it can assess several things about you depending on the way you answer it. Now, the best way to approach this kind of scenario, as with a lot of these issues, is to imagine what the patient might think from their perspective. So firstly, there's the obvious concept of privacy. A blood bottle could be labelled with name, surname, date of birth, anything like that. So at the very least, this information is now on the ward somewhere, publicly visible, including to medical staff, other patients, and even visitors from outside the hospital who have no business seeing it. And because this information was supposed to remain entirely confidential, the patient could quite reasonably think that a breach of trust has happened. And secondly, of course, having a blood sample taken is not a comfortable process at the best of time, particularly if multiple attempts are needed if people have difficult to access veins and things like that. So because of a hospital mistake, no fault of their own, they have to undergo this potentially painful procedure again. And a third thing that would be quite easy to talk about is the idea that those results will now be delayed. Because that first blood sample has now been lost, you've got to coordinate the required staff, and that could be another junior doctor, or a nurse, or a phlebotomist, and then sending that sample for analysis, hoping that it doesn't get lost on the way, and then that those results make their way back to the doctor that's supposed to be treating them. So not only is there the logistical aspect of the delay in getting these results back, but imagine being the patient. If they're anxious or stressed already about their condition, and at this point nobody knows exactly what's going on, that unnecessary delay will probably stress them out more, and that's perfectly reasonable. So the key thing to remember in this scenario, as in all of these scenarios, is be completely 100% honest with the patient. Absolutely never use euphemisms such as "a small mishap occurred" or "there has been a little misunderstanding." The problem with these phrases is that they're a little bit ambiguous, and in this case you owe it to the patient to make sure that they understand exactly what has happened. You should always remember to be polite and courteous when delivering this news, and absolutely make sure to listen to whatever concerns they have and ask them about their concerns, and to do your best to explain that you fully empathise with them. Whatever negative reaction they have, it was not their fault. So now I'm just going to give you two stock examples of ways of handling this type of question that I could think of. These are by no means meant to be perfectly accurate, but I think they're reasonable and they should stand you well. So the first one: "Mr. Johnson, I'm very sorry, but your blood sample has been lost in the hospital and we need to take another one from you. I apologise that you have to go through this again during a time that must be stressful for you. We will do our very best to maintain your confidentiality and get your results back to you as quickly as we can." And the second one: "I'm very sorry, Mrs. Lindham, but since we took a blood sample from you yesterday, it has since gone missing and we don't currently know where it is. In order to get your results back to you as quickly as possible, we need to take another one. I completely understand if this frustrates you, that's perfectly understandable, but we want to do the best we can for you moving forwards. Please let me know if you have any concerns and I'll be happy to address them." So simply put, just own the mistake and do what you can to make it right. Deliver the news in as straightforward and clear a manner as you can. Do not dress it up. There is no point because nobody wins. The patient has every right to be irritated and upset, so make sure you hear them out and make sure they feel like their views have been taken on board. They must be absolutely clear on what has happened and what is going to happen moving forward. So thank you for watching, guys. This is the end of another video helping you to get through your med school interview successfully. If you'd like to see more information and find more free resources on getting you successfully into medical school and becoming a doctor, don't forget to go and check out my website postgradmedic.com, where everything is available for free. And if you'd like to see more on here, subscribe to the channel for more video lessons just like this one. Take care of yourselves and I'll see you in another video. Best of luck.